Colonoscopy. A colonoscopy is a procedure that allows the doctor to look directly at the lining of your bowel. The colonoscope is a flexible tube about the thickness of your index finger with a bright light at the end. It is passed into your back passage and along the bowel. What are the benefits of having a colonoscopy? This procedure allows the doctor or nurse to see most problems immediately. Sometimes the doctor or nurse may need to take a biopsy. A small piece of tissue is removed through the tube using tiny forceps. You should not be able to feel the biopsy being taken. We may need to treat your piles by placing a small rubber band around them, causing them to shrivel away. We may need to remove a polyp, overgrowth of tissue, by diathermy. This is done by passing a narrow instrument through the scope and directing a small electrical charge to the base of the polyp. Getting ready for the procedure. Before this procedure, we will need to prepare your bowel by giving you some medications to clear it. Please read the bowel preparation leaflet if you have been given a copy. Please have nothing to eat from taking your bowel preparation until after the procedure. You may drink clear fluids only up to 2 hours before your appointment time. Important. If you are taking warfarin, clopidogrel or any other blood thinning drugs, it is important that you tell the endoscopy unit as soon as you are advised when your appointment will be. This is because sometimes special arrangements may need to be made to stop this for a few days. It may also be advisable to have a blood test a couple of days before your appointment to see if the procedure is safe to proceed. If you are taking iron tablets, please stop these 5 days before your procedure. Please keep taking all other medication, including blood pressure tablets, including on the day of your procedure, unless directed otherwise. If you are diabetic, please discuss this with the endoscopy unit before attending or with your consultant. If you answer yes to any of the following 2 questions, please contact us for advice. Have you ever been notified that you are at an increased risk of CJD or VCJD for public health purposes? Have you received multiple 50 units or on more than 20 occasions transfusions of blood or blood components, red cells, plasma, cryoprecipitate or platelets since 1980? Before you arrive, please remove all nail polish and false nails. Can I have sedation for the procedure? You may have a sedative injection for this procedure if you wish, but you can choose not to have any. If you have a sedative injection, you must not drive or go home by public transport. Therefore, you must make arrangements for someone to collect you. It is not appropriate to go home unaccompanied in a taxi. Please note, hospital transport and ambulances are not normally available for day patients. You will need a responsible adult at home with you for 24 hours. What are the risks, consequences and alternatives associated with having a colonoscopy? You are unlikely to have any serious side effects. However, you may experience abdominal discomfort. This is caused by the air which the doctor puts in during the examination. This will normally last up to 12 hours and will pass naturally. Colonoscopies have a very low risk of serious complications, 0.2%. This procedure can result in complications such as reactions to medications, a hole or tear in the intestine and bleeding. Please be assured that these complications are rare, less than 1 in 1,000 procedures, but may require urgent treatment and even an operation. The most serious complication is a hole or tear in the lining of the colon, a gastrointestinal perforation. This is potentially life-threatening and may need immediate major surgery to repair it. Please be reassured that this only happens in less than 1 in 2,000 procedures. Any bleeding during the procedure may be treated at the time by injecting a drug into the blood vessels to make them close up, or by applying electrical current directly onto the blood vessels to make them close up. As with any procedure involving sedation, other complications would include cardiopulmonary complications such as temporary drop in blood pressure and oxygen saturations, usually the result of over-medication and easily reversed. In rare cases, more serious cardiopulmonary events such as a heart attack, stroke, or even death may occur. These are extremely rare except in critically ill patients with multiple risk factors. It is very important that you inform the endoscopy unit if you have any severe pain, black tarry stools or persistent bleeding in the hours or days after the colonoscopy. After a colonoscopy, there can be an increased risk of this happening. If you are worried about these risks, please speak to your consultant or one of the team before you sign your consent form. Alternatives. A barium enema or a special CT scan to look at the bowel may sometimes be performed. This means putting white X-ray fluid into your bowel and/or air through a tube placed in your back passage. Then by inflating your bowel with air, it allows pictures to be taken. This procedure is not as effective as a colonoscopy and cannot allow treatment to be undertaken at that time. Therefore, you may have to undergo a colonoscopy at a later date. Patients who have had polyps removed should be aware of the very slight chance of some bleeding from the back passage. If this occurs at the hospital, the doctor or nurse will see you and give advice. If, however, you have left the hospital, it will need to be treated in either of the following ways. For a very small amount of fresh, bright red blood, take no immediate action. For a sudden passing of a large amount of fresh, bright red blood or severe pain, which is worse when coughing, contact your GP or go directly to the emergency department. We hope that by giving you this advice before undergoing the procedure, you will feel more confident about knowing what to do in the unlikely event of a complication occurring. We would like to reassure you that this would be a very rare occurrence. What should I expect? On arrival at the unit, a receptionist will check your details. You will be asked some questions about your general health, the medicines you are taking, and any allergies you may have. The doctor or nurse will then explain the procedure and ask you to sign a consent form if you already haven't signed one. If you have any questions or worries at this point, please do not be afraid to raise them. Please tell the doctor or nurse if you have had any other endoscopy examinations or any allergies or bad reactions to medications. A nurse will then take you to the changing rooms where you'll be asked to put on a hospital gown. It is useful to bring your own dressing gown and slippers. Once you have changed, you will be asked to wait in the pre-procedure room. Before the procedure, a small needle will be inserted in the back of your hand to enable us to give you sedation and painkillers. You will be made as comfortable as possible on a trolley, lying on your left side with your knees bent up. After sedation, the tube will be gently inserted into your back passage. Air will be passed through to inflate the bowel. This will allow clearer views of the lining of the bowel. It may cause you a little discomfort and abdominal cramping, but it will not last too long. You may get the sensation of wanting to go to the toilet, but as your bowel is empty, there is no danger of this happening. You may pass some wind, but please do not feel embarrassed. It is only air that is being passed. The procedure may take 15 to 60 minutes. Please expect to remain in the unit for up to 3 hours. Sometimes we may have to attend emergencies who must take priority. You may wish to bring a newspaper or book with you to read. When do I get the results? We will usually give you the results after the procedure. However, if you have had biopsies taken or polyps removed, these will have to go to the laboratory for further examination. In this instance, you may be asked to attend another outpatient appointment, or we may write to you with the results. Discharge information and at-home advice. Please be reassured that you are unlikely to have any serious side effects. However, if you are worried or experience any problems which are not mentioned, please do not hesitate to contact the endoscopy unit. If it is after 7 p.m, contact your GP, out of hours service or the emergency department for advice. For the first 24 hours after your procedure, the sedative drugs remain in your body for 24 hours and during this time are gradually excreted from the body. Therefore, there are certain things that you should and should not do. You should ensure that a responsible adult stays with you for 24 hours. Rest quietly at home for the rest of the day. Go to bed or lie on the settee. Drink plenty of fluids, but not too much tea or coffee. Eat a light diet, e.g. soup or sandwiches. Avoid greasy or heavy food, as this may cause you to feel sick. Lie flat if you feel faint or dizzy. Contact your GP if you have not passed urine 12 hours after your procedure. For at least 24 hours after the procedure, you must not drive. Your insurance company may refuse to meet a claim if they feel you have driven too soon. Go back to work. Operate any domestic appliances or machinery. Drink alcohol. Make any important decisions or sign any important documents. Be responsible for looking after small children. If you have any queries or require further information, please contact the endoscopy unit.